Newly adopted, and he came with medications, always a bad sign. This sugar glider's facial swelling wasn't sudden. It was the end result of disease hiding in the teeth and the jaw. The owner noticed swelling along the jaw that wasn't improving on the medicines provided. There wasn't a dramatic illness. The appetite was mostly normal. The activity was only slightly reduced, and that's very typical for this species. Sugar gliders are extremely good at masking discomfort and continuing to function despite ongoing disease and pain. When facial swelling finally becomes visible in a sugar glider, it usually means the body has been compensating for a long time, and that compensation has reached its limit. At first glance, facial swelling often looks like a simple abscess, something acute, something that just happened. But in sugar gliders, it's rarely a surface problem. More often, it's the point where the disease inside the mouth and jaw has progressed far enough that it can no longer stay contained. To understand why that happens, you have to understand how sugar gliders' teeth are built. Sugar gliders have diprotodont dentition. Their lower incisors are elongated and paired forward, and those teeth aren't used for chewing, they're used for grooming and manipulating food. The cheek teeth are sharp and narrow, and they're designed to slice and shear softer foods rather than grind. Medically, the most important feature, unlike dogs or cats, dental disease in sugar gliders rarely begins with obvious tartar buildup, fractured teeth, or even visibly abnormal crowns. The enamel can look pretty normal, while the bone supporting the tooth is quietly and consistently weakening under the teeth. This is where diet becomes central to our story. Sugar gliders require a very specific nutritional balance: consistent high-quality protein, an appropriate calcium to phosphorus ratio, controlled limited sugars, and low iron intake. Common feeding patterns we see are fruit-heavy diets, excessive treats, lack of calcium, inconsistent protein sources, or incomplete homemade plans, and these slowly erode bone health over time. When bone density decreases, the teeth lose stable anchoring. Microscopic movement develops at the tooth roots in the jaw. That movement allows bacteria to migrate deeper, tracking down the root and into the jaw. The progression is silent from the outside, and the mouth may still look normal from the inside. However, infection may already be present within the bone. Over time, this can progress to actual tooth root abscessation, osteomyelitis, bone infection of the mandible or the maxilla, and eventually visible facial swelling. What looks sudden is really actually late. At this stage, facial swelling isn't just a cosmetic change, it's a signal that the jaw and the surrounding tissues are involved. For a sugar glider presenting in this way, our differential diagnoses include dental disease with apical infection, jaw osteomyelitis, abscess secondary to trauma or bite wounds, metabolic bone disease with secondary dental instability, neoplasia, and less commonly, sinus or isolated soft tissue infection. These conditions can look very similar externally. You cannot reliably tell them apart based on appearance alone. That's why diagnostics are essential. For this patient, we're performing a sedated oral exam because awake exams simply don't allow adequate visualization in these little tiny guys that move quickly. We're obtaining skull radiographs to evaluate tooth roots, alveolar bone, and overall jaw integrity. And we're running a CBC and chemistry panel to assess for infection, inflammation, and metabolic abnormalities that may be contributing to the disease, including calcium levels. Those diagnostics don't just tell us what's wrong. They tell us how long it's been wrong, how extensive it is, and what kind of treatment plan this patient actually needs for this disease process. In sugar gliders, dental disease doesn't announce itself at the teeth. It announces itself when the jaw can no longer compensate. Facial swelling feels like the beginning of the story. In this species, it's usually the moment the hidden part finally becomes visible. And that's why diet, early evaluation, and attention to subtle changes matter so much in these little sugar gliders. Long before anything looks wrong on the outside, it's already brewing on the inside. Hello, I'm Dr. Pat with Little Critters Veterinary Hospital. I've been a practicing veterinarian on exotics and small animals for about 25 years now. Consider liking, sharing, subscribing, and definitely leave the comments. I love hearing from you. Thank you.